Welcome back. In our final section, I want to talk about the new directions public health is moving and what we can see ahead of us that gives us some hope that the public health enterprise is going to get stronger and better at what it does. Here are a couple of examples. I mentioned to you the National Prevention Strategy, which was developed as part of the ACA. And this is the emblem for the prevention strategy, and you can see by looking at it what are the kinds of activities that folks are looking at. Things like tobacco-free living, injury and violence-free living, active living, healthy eating. These are all parts of the strategy of trying to move us on individual, on community, and on a societal level toward having a healthier population that will live longer, illness-free lives, illness and disease-free lives. It's also a great example of an approach that has been pioneered in Europe called health in all policies. And by health in all policies, what we mean is that, when we think about all kinds of public activities, when we think about, for example, public transportation and how available or unavailable it is, it has an impact on health. When we think about school systems and public education, it's a dramatic influence on people's health and health status. On just about any public arena that you think about, it has a health impact. And so health in all policy says, as we develop transportation, education, environmental, other kinds of public policies, we also should consider the health impact of those. So the National Prevention Strategy was written by a group that didn't just include folks from Health and Human Services. It included folks from the federal departments of education, housing, transportation, justice, Treasury, state, Environmental Protection Agency. It was an attempt really to create a holistic frame to try to move America forward to a healthier future. Here's another example of how things are moving forward. This is something called the Triple Aim. Triple Aim was developed by an outfit in Cambridge, Massachusetts called the Institute for Healthcare Improvement. And it was a way to try and optimize health system performance by suggesting that all of healthcare, all of U.S. medical care and public health together need to be focused on three essential critical aims. Number one, improving the patient experience of medical care, including quality and satisfaction. Two, improving the health of populations. And three, reducing the per capita cost of healthcare. And so if you think about those three together, it's surprising. The Institute for Healthcare Improvement is an organization that has been focused on the improvement of medical care in the United States, and to include in their triple aim improving population health represents a recognition that we're moving to a different stage in terms of our understanding of what it takes to make the American public as healthy as we can be. The schism that we talked about that began about 100 years ago is starting to come back together. We look at some parts of the Affordable Care Act, like, for example, accountable care organizations, one of the innovations in Title III of the law. That rewards medical care delivery organizations that focus on keeping their populations of patients healthy and preventing them from going to the hospital in the first place. So the triple aim is getting a lot of traction around the nation in medical care and in public health. And I have also seen, by the way, the triple aim is getting traction outside of the United States. This is becoming a very compelling direction in terms of thinking about where are we trying to go, what are we trying to achieve. So I'd just like to close by saying this is a very exciting time for public health in the United States. You heard me give the litany of accomplishments of public health in the 20th century. I would say, I think in the 21st century, the best days of public health are ahead of us. We've recognized the shortcomings in terms of public health that were identified in the Institute of Medicine report, and we're looking to address them. We have exciting developments like the prevention strategy, the triple aim. We're now moving toward growing numbers of state, county, and local public health organizations getting accredited. we've developed over the past 10 years a whole new research enterprise that's called Public Health Services and Systems Research, where we now have academics who spend their whole career basically studying the effectiveness of public health structures and activities and how well they're doing in producing incredible amount of very compelling and helpful research. We're also seeing growing interest by global corporations and foundations in population and public health. We're seeing a phenomenon that sometimes I call the corporate practice of public health, where we have global corporations that are recognizing as part of their corporate social responsibility and their own bottom line that they have to be part of this kind of work and activity and that they have an important and compelling and positive role to play. And we're seeing changing incentives from the ACA and elsewhere for medical providers to engage in public and population health activities. So the challenges are great. The challenges are huge. And we're creating a greater, stronger, and more vibrant public health enterprise that doesn't just involve public health professionals. It involves medical professionals, it involves corporations, it involves people across the spectrum of American society, and that's creating new opportunities and a very exciting time for public health. So thanks for being part of this lecture today, and I hope that this has been helpful and informative to you. Thanks.